globally, about 250 million incidents happened due to UTI. And then most of those that are affected are female, except in the very old and very young, the extreme ages. And one of the factors that contribute to the antimicrobial resistance is due to irrational use of antimicrobials. People abuse antibiotics. There are times that a lot of people will go to the chemical stores and buy drugs, or they will give them suboptimal drugs, or probably those that are not even well trained will prescribe drugs or antibiotics that actually contribute to antimicrobial resistance. Antimicrobial resistant patterns, looking at it, it varies from season to season, and also it varies across the geographical settings. In Ghana, just like in other countries in sub-region, there is paucity of data on antimicrobial resistance, in particular the urinary tract infection. Because most of it, what happens, the clinicians will treat patients based on their own discretion. This clinician might choose to use this antibiotic because he or she is more comfortable with this or has confidence in this antibiotic. Another clinician might probably prefer using the other antibiotic. So they use drugs based on their choice. That means monitoring of antibiotics or antibiotic suitability pattern is very, very vital, because it will provide local data, and also it will help to guide our empirical treatment of infections. The objective of the study was to determine the uropathogenic bacteria in urine samples of suspected UTI case patients, and also to determine the antibiotic susceptibility patterns of those isolates, the uropathogenic organisms that are isolated from the suspects. The research or the study was conducted in the microbiology lab of the Eastern Regional Hospital, which is located in Kofridua, and Kofridua is located in the eastern region, which is found in the southeastern part of Ghana. And then on average, there is about 10,000 attendants per month seen at this regional hospital, on average. You can see the regional hospital, the diagram. It is actually from where you have Africa, and then the Ghana, we zoom it down to where the regional hospital is located. The study design that was used, we used a cross-sectional lab-based study, wherein we were more based in the lab. What happened actually from the beginning was we had this discussion with the clinicians and also the nurses, so that patients that are coming in, and as long as they fulfill the criteria, the clinician or the attending physician points that this particular patient, looking at all the signs and symptoms, is a suspect of UTI. In collaboration with the nurses, the patient will be explained to how to collect the clean catch or the midstream urine. So and then the samples will be sent to the laboratory at the reception. So if the samples come into the lab, we receive these urine samples from these patients at the laboratory, at the reception, right? And then data on the age, the sex, and the clinical diagnosis were abstracted from the laboratory request forms. And there is any missing variable or any missing data that we cannot capture from the request form, we were given an access to the system wherein we will extract those information. The bacteria were isolated, the urine samples were plated on CLED, cysteine lactose electrolyte deficit, AGA, and then they were incubated 18 to 24 hours, and then after 24 hours incubation, there was an observation for bacterial growth. So if there is any isolate, which is the organism of our interest, or organism that we use capable disc diffusion to do an antibiotic resistance for that. That is a plate, an example of one of the plates that we use for the capable disc diffusion method wherein we place the antibiotic disc at equidistance. But before we even started the research or the studies, we made sure we sought ethical clearance from Ghana Health Services that wrote to the regional directorate of Eastern region. Therein, the permission was sought from both of them and also from the hospital level. Results. On average, 422 suspected cases were tested, out of which 68% were females, and 3.8 or 4% were neonates. The mean age was 22.9, with standard deviation of 2, and then uropathogenic bacteria that were isolated were about 22%, 22.5%. This graph is showing the proportion of bacterial isolates by age group and sex done at Eastern Regional Hospital, Ghana in 2016. When you look at the graph, the ages were, collapsed. The age were put in the categories, 0 to 9, and then a case was actually from 0 to 60, and then above 60. That's why if you looked at it with the legend, the rate is the male, and then female are more that were affected. And even if at the age group of 30 to 39, you realize that there was no male affected. Mainly the female were affected. And that graph shows the percentage resistance of antibiotics to uropathogenic isolates, Eastern Regional Hospital. And if you looked at it also, this graph is actually showing you the pattern of antibiotics. You realize that the amikacin and nitrofurantoin were the most sensitive antibiotics. And then the most resistant antibiotics were erythromycin, augmentin, down to cotrimoxazole. One of the reasons why, I tried to find out from clinicians, one of the reasons why this thing, the amikacin, is actually very sensitive, it's because it's expensive. It's expensive, and also, the mode of transmission. And the nitrofurantoin is not commonly used as before. The proportion of suspected UTI case patients with these isolates was low. If you compare this to some findings, for example, in Ghana 2012, and proportion was high in female age groups between the 31 to 40, and then the predominant organism was Escherichia coli. Resistance was to augmentin, cotrimoxazole, and most sensitive one was amikacin and nitrofurantoin, as I explained, because of the mode of giving and also not commonly used for the nitrofurantoin. In conclusion, proportion of confirmed UTI among suspected case patients was high among females within that age group 31 to 40. Predominant bacteria was E. coli, and augmentin, cotrimoxazole were more resistant, amikacin and nitrofurantoin were more sensitive. The recommendation, we recommended that the clinicians should ensure continuous local surveillance on AMR. We also recommended that they should consider amikacin and nitrofurantoin for treating their patients in case they are waiting for the results. And then the public health action, dissemination of findings to hospitals and regional health authorities. And then due to that, there is currently AMR action plan that has been distributed to all health facilities. So these are the bodies and persons that I acknowledge, for the work. Thank you for your time.
Yeah, that's okay.